This video shows you the details of extrahepatic Glissonean approach in the right posterior sectionectomy. The target lesion tumor is located in the posterior section of the liver. The liver was originally deep-seated in the rib cage. 4 8mm size trocar robot instruments were placed on the abdomen's upper quadrant. Trocar number 4 placed just below the left rib cage to avoid collision with trocar number 3. An assistant helps the operator with a laparoscopic instrument or suction device through the 12mm trocar. I used a long plastic tube to apply the Pringles maneuver through the 2mm size incision site. This method is comfortable to apply the Pringles maneuver, too easy, too fast. First, the cholecystectomy was performed to expose the hilum of the liver. I prefer to use 4x4 gauze for the effect of cushioning or clearing. One gauze was given to the assistant, another gauze was put in the subhepatic area. Right posterior Glissonean pedicle was identified around the luviated jucus. I tried to separate the Glissonean pedicle from the liver parenchymal. Luviated jucus was widened to make it easy to approach the Glissonean pedicle. From the hilum, dissection was performed around the Glissonean pedicle. The caudate branch of the portal vein was coagulated with the bipolar and energy device. Dissection behind the pedicle was difficult. Small branches was divided carefully. Breathing control was performed using the bipolar forceps. Further parenchymal dissection beyond the luviated jucus was performed, and widening space was to make it easy for the isolating the Glissonean pedicle. A string was inserted behind the pedicle and then it was taken on the opposite side. The string was encircled and ligated the pedicle. The plastic clip was applied to ligate the pedicle. After making the stitches, anatomical resection line was made under the fluorescence camera. liver parenchymal dissection for the right posterior sectionectomy was performed. I started the parenchymal dissection along the resection line. Crushing was proceeded with a small bite. Parenchymal dissection was performed with crushing and bipolar coagulation. With the active braid vibration of the energy device, fine dissection was performed. The pathway of the right posterior Glissonean pedicle was identified, and small branch was resected. The previous clipped right posterior Glissonean pedicle was divided. Pringles maneuver was applied to reduce bleeding and make a clear operative field. We combined the bipolar crushing and braid fine dissection method. Intersectional parenchymal dissection was advanced. During the deep parenchymal dissection, the right hepatic vein was encountered. A small branch of hepatic vein was isolated and divided. Chordator lobe transected, and then inferior vena cava exposed. A big-sized right inferior hepatic vein was resected after applying plastic clips. Liver parenchymal dissection was finalized around the right hepatic vein. The specimen was detached from the diaphragm with a dissection in the bare area. Specimen was put in the bin bag. With the lowering abdominal CO2 pressure, the irrigation and hemostasis was performed. Thank you.